So joining us now, on to our next guest here today. We are so excited to have you here. Many of you know that we've had a wonderful segment throughout the year called Ask a Nurse, and today we get Ask a President. It doesn't happen very often. This is the president of Mount St. Joseph University. His name is Dr. James Williams. Welcome to you.
Thank you.
We are so honored to have you give us your time for a couple things, but let's start with the Centennial Celebration.
Well, absolutely, Liz. This is our centennial year at the Mount. We were founded in 1920 by the Sisters of Charity of Cincinnati, and this is an opportunity this year for us to celebrate and pay homage to the sisters, but equally importantly, to thank all those who come before us, faculty, staff, students, and this community for supporting us for over 100 years now. We appreciate the opportunity that we've had to make a difference in this community, to care for the common, to care for the common good, to make sure that we are being responsive to this community's needs. So this is the year that we're supposed to celebrate, and we're not going to let the virus interrupt that. It's not going to disrupt it anymore. Okay,
so we have a few photos of things. Tell me a little bit about the celebration. How do you do that with some distancing and things that we're doing?
Well, it's interesting because this virus has caused us to do things differently and to do some different things. So, for example, our Centennial Jubilee that we had planned for April, we couldn't host. So now we're going to have to move that to September. We also had to make an adjustment in our graduation exercises, as all other colleges and universities had to. So we had to do that virtually rather than be there in person to help those young folks celebrate. So we have to do some things differently, but we're still celebrating, and we're still optimistic about sort of what our future is, and we're really pleased and we're proud of what we've been able to do over the last 100 years.
Yeah, you know, it's been interesting having been here just a few of those years. I've seen your growth. I've seen you just bring this campus to a new place, which has been really fun to watch. But also, you're building something new, which, you know, we have met your nurses and your PAs and many of the medical teams that could never be more timely than we have a need for right now. But you also have a new athletic center, and I wanted to mention that because I know that was a big part of a campaign. It sends a message to students that's really important. So we have some photos we want to show you about that, but tell us about it.
Well, we're calling it our Centennial Field House, and we have a fitness center attached to it. But the whole idea was to make sure that students have what they need so that they can continue to develop themselves, not just mentally and spiritually, but also physically. And we know that our health sciences programs are tremendous. Our athletic training program, for example, our physical therapy programs, all of those programs will be able to utilize this facility. So we know that we're going to be supporting all of those kinds of activities with this new construction. And we're well on target to finish by the middle of November. So we're looking forward to that.
What an exciting thing that you didn't have to stop that. They could work outside. Okay, final thing that I'm kind of most curious about. Nobody ever can prepare, even as a leader, for the times that we've been through. So I'm curious what you have learned about leadership in a time like this, because it really is about how we lead and who we lead.
I agree. Yeah. And you said it right when you said, and who we lead, because that's been the big difference for the Mount. We were able to make the adjustment that we had to make as quickly as we had to make it, not because those of us in top administration were leading as effectively, but because all the faculty, the staff, all the persons who make the things happen day in and day out were leading themselves and leading each other and working together and collaborating to make sure that we achieved the final goal. And the final goal was to make sure that we could continue to deliver quality education in a supportive way to all our students. So it really is about the collective group. We talk all the time at the Mount about we, and we talk about colleagues as one, including faculty and staff. And that makes all the difference in the world. So we're as successful as we've been so far through this crisis because of the folks with whom we work. There's no doubt.
And along that way, then, you've started to make plans to open in the fall. Just drop me a little hint.
Well, we have begun to make plans. And we have two challenges. The first challenge is to make sure we can bring faculty and staff back to the campus safely. So that's what we're working on right now. We probably have 35 to 40 folks who are on the campus on a daily basis right now. But we are looking to move all of our faculty and staff, at least as many as makes sense, from working from home back to campus-based operations. But we have to do that in an organized, systematic, logical way. And so that's what we're doing right now. All through May, we have been planning, how do we get those faculty and staff members back on campus in a way that's safe so that they can be productive. The second challenge is much more daunting. How do we bring students back to the campus? And we're making plans for that. We haven't decided exactly how we're going to do that yet because, all the challenges that we have with trying to bring the staff and the faculty back, are doubled and tripled.
The students will be easy, I promise. Well, here's what I'd love. When you figure that out, you come back and you tell us. We'll be here
Absolutely.
waiting. We know you'll be a model because you have great leadership. Dr. Williams, thank you
Thank
so
you.
much. It's a
We
pleasure to
appreciate
share
you.
your work. All right.
Thanks,
and we'll
Liz.
be right back.